That's right, Family Medicine's leading voice in social media, in my own mind. This is the Family Medicine Rocks podcast live on the Blog Talk Radio Networks. Our top story here has to do with this story from the Columbus Dispatch newspaper from Tuesday, November 1, 2011, 7:06 a.m. The title here is 1 million in Ohio lack family doctor. What? I know. And I've been getting some emails here for the past few days saying, Mike, why does this drive you nuts? What? Why? I mean, it's a nothing really type story. Like, why are you just so revved up with this? Well, let me just read this here to you. I'll read parts of this and react to them. And if you want to follow along, you can go to FamilyMedicineRocks.com. There's a link there. You can also go to the Columbus Dispatch website and read the story there. Here's the first sentence. The first sentence goes like this. Nearly 1 million Ohioans say they don't have a family doctor or nurse practitioner who they can see about health problems. That's the leading sentence. Yeah, sure. That gets some attention. It gets later in the article here. I'm like, where did this come from? So the article says this comes from the Ohio Family Health Survey, and the article says it's a regular assessment of health by government, Health Human Service Agency, and university officials across the state. For the 2010 survey, 8,276 adults responded. There were 2,002 responses for children. So how did they come from 8,276 adults to 1 million Ohioans? That's the first question that I have. The second paragraph of this article goes, of those, they're referring to the 1 million. Of those, 43% they don't need a family doctor because they're healthy, not because they don't have insurance. Researchers said, according to the article, this finding suggests that a mandate under federal health reform that everyone have health insurance is not enough to ensure that people will get regular care. What does that statement mean? That statement is aimed directly to Ohioans here voting on Issue 3. That's right, Issue 3 coming, the election day is next week, having to do with a change in the Ohio Constitution affecting a possible federal mandate for people to purchase health insurance. I think that's where that came from. And that's what people have told me in the past few days. They're like, Mike, this is a totally political article. Why are you getting so wrapped up with it? Well, I'm getting so wrapped up with it as I go through this whole article. There is not one quote from a family physician. There's not one. There's one quote here in this article, and it comes from an emergency room doc. And nothing against emergency medicine. But if the title of the article says family docs, you would think that the reporter would call somebody who's a family doc and say, hey, what is your reaction to this study? That's one thing that gets me all upset. The next thing is, where do they get their numbers? They don't explain it. I go to this Ohio Family Health Survey website, try to find some data so I can do my own interpretation of the raw data. There is nothing there. At least nothing there that I could see. If people have the link to where the study is so where I could look at it, send it to FamilyMedicineRocks.com and I'll look at it. But how they went from 8,276 adults in this survey to 1 million Ohioans say they do not have a family doctor to see about health problems. What is that about? I don't get that. And then they say in paragraph 2, because people don't get past paragraph 1, paragraph 2, of those 43%, they don't say they don't need one. And later in the article, it says, in the second highest response, 29% of those surveyed said the high cost of health care kept them from having a regular doctor or nurse practitioner. So that's kind of buried in there in the middle of the article. So, and, later that day, it got picked up by the Associated Press. And as I'm looking across news stations across the great state of Ohio, a lot of people did pick up this story, including locally here at Family Medicine Rocks World Headquarters. There's been a lot of commentary on it. And, why didn't they ask a family physician? Why didn't they ask the Family Physician Organization of Ohio, namely the Ohio Academy of Family Physicians? What is the deal with that? So, but I am happy to report that the Ohio Academy of Family Physicians did send a letter off to the Columbus Dispatch on Wednesday, November 2, 2011. It goes like this. The findings of the Ohio Family Health Survey in Tuesday's Dispatch underscore the need for the patient-centered medical home, PCMH, model of care. Patients need a primary care physician, such as a family physician, when they are both healthy and sick. Developing a patient-physician relationship while healthy promotes preventative care focused on well care rather than sick care. The letter goes on to say if every Ohioan had a PCMH, they would have the following: a personal primary care physician and a medical office team that provides for your care, ease of making doctor's appointments with shorter waits and same-day scheduling of appointments for those things that cannot wait, convenient consultations resulting from enhanced communication options, for example, email and telephone interaction, appointments and services that fit your schedule, access to health and information technology, electronic health records, and clinical information that eliminate duplicative, if I can say that, services and tests, easy access to lab and test results, a collaborative partnership with your physician to maintain good health and avoid sickness, patient education that allows you to make a better informed decision on recommendation treatments and helps you follow your treatment plan successfully, health reminders and assistance with self-care and counseling. If you had a PCMH, why would you want or need to go to the emergency department for primary care? Exactly. Colette Willens, MD, family physician, Westlake, Ohio, president, Ohio Academy of Family Physicians. So that's great. I'm glad that the Ohio family physician community came to came to bat, did not ask for an opinion, gave out an opinion, showed some leadership out there, and say, hey, this is what we think. That's one of the great things about traditional media, social media. You can get your opinion out there. That's part of the reason for this show. And say, hey, I know a lot of people, even people that I talk to, say, my primary care physician is an emergency room doctor. That is not how things should be done. And if you've listened to the show before, you've known that I've talked about the patient-centered medical home in the past. I think that is the solution to this broken healthcare system. The family physician community has been saying that for a long time. And I think this article is an opportunity to make another point about that. So we'll see what happens. I'm hoping that the Columbus Dispatch and other news organizations around the state, when they have issues like this, hey, reach out to a family physician. Call me. I'll talk to anybody. You can see I'm not shy. Just go to FamilyMedicineRocks.com. There's my contact information there. I'll be happy to talk about anything to anybody. I also wanted to point out on the Columbus Dispatch website, they do have their hot topic issue entitled, Do You Have a Family Physician That You Visit Regularly? And this is where people can comment. I encourage you to go there and check that out. That is attached to the 1 Million in Ohio Lack Family Doctor article. So interesting feedback from people, from readers of the Columbus Dispatch. So I will take a break here, and topic 2 will be about advocacy, the more broad topic of advocacy. This is a small topic here. We're talking about federal stuff that family physicians can and should do. Right after this, my name is Mike Sevilla. This is the Family Medicine Rocks podcast right here on Blog Talk Radio. We'll be right back.